Hi, my name is Kamal, and I have incurable cancer. I'm hoping to find a cure for my disease. It's called Lundstrom shortcut W lymphoma, which is a rare type of blood cancer diagnosed with cancer on 28th April 2021. Unfortunately, there's no staging. However, I asked my consultant on the day of diagnosis what stage I am. She said, there's no staging. However, it starts with your bone marrow. It is stage 4. And of course, there's no cure for your disease. It is advanced, complex, bulky disease, which has no cure, but is treatable. I'm here to share my journey with you guys. I also share on YouTube, K-Vlogs YouTube, known as komalvlogs. I had R-CHOP chemotherapy. I had 6 cycles for 5-6 months. Every 3 weeks, I need to have chemotherapy. When I had my first chemotherapy, it was during the COVID time. My family was not allowed to come. I was all alone. It took me months and months to accept my cancer. But I'm here to tell you the truth, the reality about what goes through a cancer patient mind. It is hard for me to talk about chemotherapy and how it traumatized my body, how I wanted to give up every single month, thinking that I cannot do it. My body cannot do it anymore. It's traumatizing. It was a torture for my body to take of this R-CHOP chemotherapy. I've been giving my interviews, cancer interviews, to Lymphoma Action, the patient story, and I was so scared. I don't know what to expect. Everyone was telling me, expect the worst, because the side effects, it's bad. But nobody actually told me what kind of side effects. They said not to read it. They did give me the leaflet, but I didn't read it. I didn't do pre-surgery, freezing eggs, where, you can speak to the fertility clinic, talk about options, freeze your eggs, but they said that they can't delay my treatment. It was a choice given to me whether I choose pre-surgery or my treatment. But knowing that my symptoms were getting worse, I had spleen that was 3 times larger than its normal size. I was in pain, nose bleeding. I knew that something was growing inside me. I had so much tumors in my stomach. It was a bulky disease I have. I had B symptoms, weight loss, literally losing weight without me trying to. I couldn't eat. I felt my body was collapsing. My body was giving up on me. I didn't feel good. I was very aware that I need to do treatment. I didn't complete my cycle. They did rituximab. They put the speed, and as far as I know, I didn't take it well. I felt suddenly palpitations. I'm glad that they stopped, and towards the end, I did feel like I was getting sick, and it's just a horrible feeling, to be honest, because on the day I didn't complete it, they say you have to come back and get yourself completed the first cycle. I couldn't even eat banana. I felt there was something wrong with my mouth. They did give me anti-sickness, but it didn't really work, to be honest. I did get steroids as well. When you get your chemotherapy, you start with day 0, but actually you start with day 1. You get all the medications you need to take to prevent any kidney damage. You need to have that tablet. You need to have steroids. You need to have anti-sickness. You need to have lansoprazole for the stomach acid in the morning. I remembered in the first day I had to take 14 tablets. It was the worst. I was feeling sick and I did take anti-sickness, then I was fine. I'm glad my mom came along, and I remembered I wasn't not feeling well, to be honest. I couldn't eat anything because I felt like there was some ulcer going on in my mouth. Things were a little awkward. I'm happy they do give you crisps, I'm gonna be honest. When you have chemotherapy, you don't feel hungry. Before chemotherapy, I do feel hungry. I can eat. But after chemotherapy, you don't eat. You can't eat because it doesn't make you hungry. And you do lose weight. That I need to tell you. you feel suddenly collapse because your red blood cells are wiped somehow, and you feel like sudden drop. My mom have seen that. My mom have seen the worst. The side effects was worse on the, because your body's not used to for the chemotherapy. Everything is like introducing, your body is getting introduced, so obviously your body hasn't recognized it. There's one thing a lot of people don't know, but you cannot talk during chemotherapy, especially when it's the day one after the, the side effects are starting. It doesn't allow you to talk. I couldn't be on social media for 1 week because you don't want to be social media can be toxic, and you really need to have some rest. Rest 1 week at least. Now, about the food, I couldn't even eat much, but I had to eat it because of the tablets. Otherwise it will harm you. These are one of the common side effects is being sickness, and that's what I have felt. And also weird on your mouth, cold sores. At this point, you don't need to mingle with anyone or meet anyone. You need to be at your home, be safe, because your immune system is so, compromised. It's been not easy for me, and when I completed my cycle 1st June on 2021, my mom came with me, God bless her, because she was not even allowed to be inside the day unit. They don't allow you because during that COVID time. One of the nurse, she's really nice. I really liked her. Great feedback I've given her. And she was there to take care of me. You do get pre-medication, and then you wait for the blood test to come back if it's normal, or some sort of not even normal that time. But if it's like, yeah, they can do it, then they were able to do rituximab, which they started slow speed, which I find it really easier, and it helped. I didn't get any sickly feeling after that or anything. However, my hair started to lose. I didn't shave my head. I just want to say the IgM was 24. It was quite high when they initially wanted to treat me, and 31 centimeter was my spleen size, and I had large tumors sitting in their stomach area, very multiple. So it was many. It's not just one cancer sitting in my tumor, in my stomach area. It was many, and they were behind my spleen. My spleen was in the surface, so it was so hard for them to do a lymph node biopsy. So they did the bone marrow biopsy under GA. I'm just here to share my story so that one day I feel like we can find a cure for it. And I'm sure there's many people who are fighting with cancer, different types of cancer. Remember, each body has a different cancer, and whatever they can take it, tolerate it, is different from each other. We can't compare with each other. Cancer comes to anyone, any age. They told me on the day of the diagnosis some myth that sugar feeds cancer and cancer feeds sugar, vice versa. I did ask on the day of the diagnosis if there's a food diet I have, and they said no, I don't have a food diet, I can eat anything. Maggie's Cancer Center, not sponsored, but I just want to say I do go to them. They have different activities. They got yoga, they got Tai Chi, they got art class every Thursday, depending which center you go to. That's how I got to know about Maggie's, honestly, Cancer Center, by my consultant. Don't forget to subscribe to my channel, komalvlogs, handle K-Vlogs YouTube. Thank you so much for listening to my podcast, and you guys take care. I will see you in the next one. Bye.